Okay, guys, this is Caleb Jones. This is the Alpha Male 2.0 podcast, freedom-focused lifestyle design for men. And today I have a very special treat for you guys. A bunch of you guys have actually asked about this, so asked and answered. I have on Skype with me today my personal testosterone doctor. There's a better term for it, but I call him my testosterone doctor, Dr. Phillip Fowler. How are you, Dr. Phillip?
Good morning, Caleb. I'm doing really well. How are you doing?
Very, very good. So let's see. You've been in practice for 14 years, naturopathic physician. You specialize in anti-aging and men's health. And you and I have been working together. I just looked this up. My original articles I wrote on when you first got me started on TRT, that was 2014. So you and I have been working together for 6 years, long time.
That would have been out in Auburn, I believe, originally, right?
Yeah, correct.
Yeah. Wow.
Yep.
Long time.
And the story is, some of you listening, I've heard this, but my story with Phillip is that I interviewed, I think the number was 4, when I made the decision to start doing TRT, and that is, by the way, testosterone replacement therapy. We'll talk about it in a minute. I interviewed 4 different doctors, and Phillip was the only one that actually answered my questions. A lot of the other doctors were like, oh, yeah, well, and I would ask a question. They go, well, come on down. Let's set an appointment. Come on down. I said, okay, I don't want a fucking sales pitch. I want information. I want someone who knows what they're doing and all that good stuff. And I have mentioned on prior videos that when I went on TRT, a number of things happened, all of them good. One is my income went up. I don't know if I ever told you this, Phillip, but my income went up 82% within a few months. Yeah, 82%. Yeah. So the cost of the testosterone therapy more than paid for itself. More energy, my sleep improved, more muscle mass when I lifted weights. I mean, it was just across the board. And I've said, Phillip, to guys that going on TRT is literally one of the best decisions of my entire life. Literally.
You know, Caleb, that income factor is a standard across the board with all of the CEOs that I work with, all the entrepreneurs I work with.
Oh, really? Really?
Yeah, probably about 40% of my practice is entrepreneurial men.
Yeah, makes sense.
And they all have said to me the same. Yeah, my income went up significantly because I'm doing this. Yeah.
And so it cost me a few $100 a month, but I don't care. I make way more than that. So it's actually, my testosterone, my TRT protocol is actually a profit center for me.
Right. Yep.
Yeah, it's great. I could go into some detail on my understanding, but I'll let you do that. So could you explain in layman's terms what TRT is, particularly the replacement aspect? Because a lot of guys say, well, this is steroids. This is not. This is a natural. This is bad for you. This is external and exogenous. And so what TRT is and what types of men it can work for and what types of men probably don't need it.
Right. Okay, so you have to start with the concept of age-related hormone decline. That's how I ended up here. So my first 6 years of practice was family practice, and I started to notice, geez, all my 40-year-olds, they all come in with the same set of symptoms. And I thought, geez, these gals and guys all need to have something in common to explain this. Long story short, I started doing menopause and thyroids. Next thing I knew, I started doing testosterone replacement therapy for men. I started going to symposiums on all this. Everyone, as we begin to age, your testosterone, your estrogen, your human growth hormone, your progesterone, your cortisol, all these things begin to drop off as you cross about 35.
Yes.
And by about 40, most men have noticed it. Now, naturally speaking, all men are going to lose testosterone starting around age 35, and it's going to begin to decline, and this is normal. However, it's also quite unpleasant. And when you factor into that, Caleb, that we're going to live a lot longer than we used to on average, right? 40 used to be pretty old.
Yeah.
Okay? Even 35, 40 years ago, 40 was getting up there. But you go back 150, 200 years, which is really nothing in time, right? That's a short amount of time. You go back that far, and 40 is quite old.
Right.
Right? Medicine has come so far. Hygiene has come so far. Civilization has come so far that we just live a lot longer. And in 2020, we'd all like to be quite active well into our 70s.
Right. That's my objective, well in my 70s.
Yeah, physically, mentally, sexually, right?
Right.
So for most men around 40, their testosterone begins to decline. They begin to feel tired. They lose their creativity. the one thing I noticed was, I play guitar, and I'd pick up my guitar and I'd be like, I don't know. I don't have any, I play more by inspiration than I do by reading music. And I didn't have any creativity. And that was
motivation too, right? Because I hear guys like, I'm just not motivated to get off my ass and do anything.
Apathy is one of the first things I'll hear from guys is, I just, and I hear it a lot from dads. They'll be like, I get home from work and I put in what I had to do. And man, I don't want to play with the kids. I don't want to take the wife out and do anything. I just want to sit quietly. I want nobody to bother me.
Yep.
They don't like feeling that way, but you do it for a couple of weeks and you fight it and you go, I don't know what the hell this is, but I feel like crap. And
I've seen that happen with a lot of my friends who are my age, guys I work with, guys who I'm related to. My dad, I saw him go through that. Yeah. Where you're vibrant and you're on it in your 20s and 30s, and you're right. You're exactly right. 35 is when it starts. 40 is when it gets really noticeable. Early 40s for a lot of guys, yes.
Yep. And then factor into that around 42 or so, their erections begin to fade.
Yep.
And that for a lot of men is quite tragic.
And here's the problem. And you and I have discussed this, and I've discussed this a million times. These guys go to their normal general practitioner doctor, who is very well-meaning. And the guy says, my dick doesn't work nearly as well as it used to. And the doctor says, and the doctor may even run some blood work. And the guy says, yep, that's right. That's normal. That's how it is. You're healthy.
And he's right. It is normal for aging.
Yeah.
But also true, Caleb, is we can very safely do something about it.
Well, and like to your point, which is a really good point that I've never thought of, what is not normal is us living to age 80. That's not normal.
Yeah.
So it would be valid for doctors to say, well, that's just normal. You're in your 40s now. Your dick doesn't work as well. That's the way it goes. That would be fine if your life expectancy was 55. That might be okay, but it's not. It's getting into your 90s now.
Yeah.
Right.
And I don't know about you, but 40 years without sex is a long time.
Yeah, no thanks. I'm good, thanks. Right. That's right. And so let's see. I would imagine that most of the symptoms that guys are reporting to you are things like I'm not motivated, I'm not creative, sexual dysfunction. You probably don't get a lot of guys saying I lift weights and I'm not getting the response from my muscles. And you don't get a lot of that, do you?
Yeah, I do. I get guys a lot of my guys are pretty fit. And the one thing they'll come to me saying is, I used to be able to work out 5 days a week. Mm-hmm. But now muscle recovery has slowed so that I work out and it takes me 3 days to be able to go back to the gym.
Oh, really? You are getting that. Okay. All right.
Yeah.
And that starts around 40-ish?
Yeah, 38 to 40. I'll tell you a quick story. The first testosterone guy I ever had, he was built like Lou Ferrigno, the Incredible Hulk, the guy who played
Damn, yeah, I know. Yeah.
And he came in, and I'd been doing lots of female hormones and thyroids, but there was sort of a stigma around testosterone, right? Around using steroid therapy and
long time.
He looked like Lou Ferrigno, sat down across from me and said, "I need testosterone," and I poo-pooed him and said, "You look like you need testosterone, like I need a second hole in my head."
Yeah.
And I kind of said, "Listen, dude, I'm not a drug dealer, and that's not what I do." And he came back a week later with his wife, and she brought some labs and she brought a book. And she said, I understand what you see, but let me tell you something. This is not the same man he was a year ago. His mood has changed. His outlook has changed. His motivation is gone. He's not interested in sex. Would you please read this book and look at these labs? And I'm forever grateful to them because they really opened my eyes. And I went home and I did read the book. And that was how I discovered that men go through menopause the same as women. In males, we call it andropause. Huh. But men go through this the same as women. And it doesn't matter if they're some big muscular dude or some long, skinny string bean. It affects everything in their life. Your testosterone has so much to do with your personality.
Yes.
Your confidence, your ability to be sitting in 2020 and go, yeah, everybody, don't worry. It's going to be fine. That's testosterone.
Yeah.
Is that ability to have an outlook that goes, yeah, COVID, riots, smoke, we'll be fine.
I call that outcome independence. That's what I call that.
Yeah. Exactly.
Right.
And
so you're saying that it's the opposite.
It's hard to muster that.
Yeah. And that's a really interesting point. So you're saying it's not necessarily guys who are screaming and ranting and loud and angry a lot of the time who have high T. No, the high T man is the opposite. The high T man is much more even keel with his emotions. Or is that?
Absolutely.
Interesting. Okay, interesting.
Yeah.
So it's easier to regulate your emotions when your testosterone is healthy?
Does it regulate your emotions?
Is it easier to regulate your emotions?
Undoubtedly.
Or manage your emotions?
Undoubtedly, it's easier to regulate your emotions.
Interesting. Okay, never thought of it that way.
It's effortless. It's, you know what I mean? For the most part, it's effortless. You just feel good. When your testosterone is low, people feel very irritable and short on patience.
Oh, right, of course.
Yeah, especially it compounds because they also feel more fearful.
Oh, right. Oh, that I definitely see. Low T guys are terrified. Yes, I definitely see a lot of that on the internet. Oh my God, yes. Oh my God.
And the more fearful you are, the more that's eating at your brain, the more irritable you're going to be.
Right. Okay.
And then also true, other end of the scale, you've got somebody who's abusing testosterone. Well, they're going to have a whole different set of problems.
Sure. Right. So that's a perfect segue. Let's talk about that because that's one of the concerns a lot of men have. And I've explained this a few times, but I'm sure you can explain it better. I'll give you kind of my brief summary and you can tell me if I'm right or wrong or give more details. So testosterone, TRT, the R in TRT is replacement. So you are not jacking your testosterone above, and I'm going to use American numbers here, guys. So if you're outside the United States, just convert to your own numbers. Total testosterone, meaning the range, my understanding is ideally, if you want to be optimal, is between 800-ish and 1200-ish, but not more than 1200. Is that right?
Yep, that's spot on.
Okay, perfect. So if you jack your testosterone way past 1200, now you're in the steroid user zone, which is stupid and very unhealthy.
Yep.
Correct?
Yep. Absolutely.
And I remember I went to you when I first went to you back in, a billion years ago. I said, I want my I forget the number I gave you. It was some huge number, like 1400. Yeah. And you said, no, you do not want to, you don't need to go to 1400. You don't want to go to 1400. You said, let's get you to 900. I think back then it was around low 600s, I think.
Yeah.
And you said, let's just go to 9 and let's start there. And boy, were you right. 9 was plenty. Today I'm at 1140, 1130. But yes, so you're talking here about replacing the testosterone you left, not jacking your testosterone into superhuman levels where your body was never designed to handle those levels.
That's 100% correct. You're hired, Caleb.
Okay, thank you very much. And what would you recommend? What I tell guys, and again, give me your more professional opinion. What I tell guys is, if you want to optimize this, as you get older into your 40s, your testosterone should be above 700 and obviously less than 1200. But if it's below 700 into your 40s, you're not optimal. That's what I tell my audience. What is your opinion on that?
Yeah, those are great numbers. Those are great parameters. And you've got to put with that, because every body is different. If you're not feeling well and your testosterone is 600 or 500 or 400, then you've probably got a problem that could be helped, right? So my point is this: if somebody's got a testosterone of 650 and they feel great, there's no need to do anything.
They leave it alone. Okay.
Yeah.
Good point.
What I'm saying is I never treat numbers. You know what I mean?
I see.
There's got to be a symptom picture that goes with it, and then you go, yeah, that can be treated. But if they're 650 and they're like, no, I have all the energy in the world, I sleep great, I'm having sex 3-4 times a week without a problem, that's not, you don't need to treat that.
Yeah. Okay. That's a valid point. I never point that out. I should probably say that more often. Good point. Although I would imagine, correct me if I'm wrong, what you just described, the guy who's post 40, who's got testosterone of 600, 650, and everything is perfect, is the exception to the rule. Is that correct?
Undoubtedly.
Yeah. So that's really rare. Yeah, there are genetic freaks
in my practice of that guy.
Okay.
And his wife drags him to my clinic once a year.
That's funny.
And he sits there with his arms folded and nods at me the whole time.
Yeah.
And I'm like, all right, you look good. Have a great year.
And he's fine. He's not reporting any symptoms, you're saying?
Nah, he's 70 now and he's a rancher.
Oh my God. Okay, cool. Yeah. Well, that's great. He's 70 and his natural total testosterone is 650-ish?
Yeah. And he works in a field 12 hours a day.
Wow.
Yeah, he's kind of a badass. But he is
that's just genetics, right? Is that genetics mostly?
It's genetics and lifestyle and genetics.
Yeah.
Because I have a lot of guys. I have a lot of guys who are 35, 37, and they have lived healthy to the T.
Yeah, right? Sure. Yeah,
dotted every I, right. And their testosterone is 400.
Oh, right. Okay, and they have symptoms.
And they're symptomatic. They're like,
right. Of course. Okay. So I do, as you know, for the audience, I do a protocol where I take testosterone twice a week, and I do HCG twice a week. And that's something that you recommended, and I'm glad you did because there's extra benefits with HCG. Could you explain that, why it's a good idea, at least for some men, to take HCG along with their testosterone?
So, first of all, let's talk about the twice a week on the testosterone. The half-life is generally 7 days, but in a lot of men, there's a large peak after the first injection, and then it slowly goes down, and by day 3 or 4, you've got a pretty decent trough, and you've still got 3 days to your next injection.
Okay.
We found it beneficial to do a smaller dose twice a week, and this way we have a smaller peak and a smaller trough, and you feel more even in the end is what happens.
Mm-hmm.
And the HCG, which is now we're using a product called gonadorelin.
Oh, right.
But same function. The big idea is if we bring in exogenous or outside testosterone into the body's going to shut down production in the testicles because the thermostat in the hypothalamus pituitary in the brain, the thermostat is set to 450, right? It's been turned down as you got older, the thermostat. That's how endocrinology works. There's this thermostat up in your, I'm using an analogy, thermostat. But up in your brain, there's the hypothalamus pituitary, which is taking measurements of things and saying, okay, yeah, set point is 900 at 22 or 1100 at 22. But now at 40, that set point is set at 450. So if I give you testosterone and your brain takes a reading and says, yeah, there's 700 of testosterone, turn off the testicles.
Mm-hmm, right.
Well, if you turn off anything, if you don't exercise your bicep for 3 weeks, guess what?
Right.
It got smaller.
Right.
Same's true of the testicle. If you're not using your testicles, they're going to get smaller. So we give the HCG so that we continue to bind to the receptor on the testicle or the gonadorelin, to continue to bind to the receptor on the testicle, continue to have the testicle function, and thereby not have the testicle shrink, which is important for a few reasons. Number one being cosmetically. Nobody wants to have tiny testicles. And number two, let's say for some reason you decided I'm going to go off TRT for 6 months. Or let's say, God forbid, there was something, enough things going on that FedEx wasn't shipping things.
Right.
I want all my patients to be well prepared if ever they are going to go off testosterone. Their testicles will function just the same as they did before they went on.
Right.
That's the big point. Now, there's a third factor to it, which is when you bind to that receptor on the testicles, there's a cascade of events that happen that tell the body we're raising testosterone levels. There's ejaculate production, so the seminal fluid, right?
Right.
So if you just do testosterone, those other things go down too, right? And men will have ejaculating, right?
Is that FSH and luteinizing hormone? Is that what those two? Is that
FSH and luteinizing hormone are the pro hormones that come from the pituitary, go through the bloodstream to the testicles, and bind to the testicle to stimulate the production of testosterone and sperm.
Got it. Okay.
So HCG or gonadorelin replaces those. It works exactly like your furnace and your thermostat, right?
It keeps the thermostat high.
Well, the FSH and LH, or in the in the treatment protocol, the HCG or gonadorelin, that would be equivalent to the amount of current flowing from the thermostat to the furnace.
I see. Okay.
Right? How loudly or how much is the thermostat asking the furnace to work?
I see.
Yeah.
Okay.
Yeah. The testicles in the analogy are the furnace, and the hypothalamus pituitary are the thermostat.
I think it was you who explained to me years ago. Yeah, this was you, where you said you said exactly what you just said. You also said, if you can imagine your natural testosterone, like on a vertical bar chart, you have your natural testosterone, then you have exogenous testosterone that stacks on that. We want to retain as much natural testosterone as we possibly can, so we don't have to add as much exogenous testosterone.
And in short, that's the function of the HCG or gonadorelin.
Which I really appreciate, yes, because
you were saying the outcomes are just so much better when we do that.
Now, let's see. We're gonna get a little personal here, guys, a little sexual, but you guys can handle this. So I noticed, one of the things I noticed when I went on TRT is that not just sexual function. I didn't have a huge problem with that earlier, but there was an improvement. But there was also an improvement in feeling. It felt better. Like, for example, when I had sex with condoms, the sex felt way better after the TRT than before with the condom on. And I think you said that a lot of that is the HCG. Is that, or am I remembering that wrong? Right or wrong?
No, it's, stimulating the testicles to produce endogenous testosterone locally.
Mm-hmm.
And when I say endogenous, that just means from within the body.
Right, internal.
Right? Exogenous is outside, endogenous is inside. When you produce that testosterone endogenously local to the penis, right, the penis is going to get a dose of testosterone which nourishes that tissue.
Oh, of course.
Which also creates more sensitivity in the what we technically call the glans penis, also known as the head of the penis.
Right.
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 And you will have more sensitivity, better orgasms.
Oh, better orgasms. I didn't mention that earlier. Yes. Yeah. Hell to the yes. I was amazed.
The same is true for the females. If as they age, they'll lose the estrogen and testosterone nourishment of that tissue, and they'll have dryness, and they'll have tearing, and they'll have a loss of orgasm.
Oh, interesting.
Every now and then I'll have a guy who'll be 6-8 months into therapy, and he'll say, I'm still not having great sexual pleasure, or, it's still really downhill, the orgasm ability and such. And I'll give him testosterone cream to put on his penis.
Mm-hmm. Oh, really?
Yeah, it'll fix it.
Not his testicles?
Nope, right on the head of the penis.
Interesting. I've never heard that before.
That's going to be helpful too, but that's more for absorbing testosterone for systemic use.
Oh, I see.
Directly,
almost like a Viagra type thing.
Yeah, well, and we should talk about erections and Viagra, because the testosterone cream to the head of the penis is directly to nourish that tissue and increase sensitivity.
I see. Okay.
I'll have guys who are 44 and they're like, I really love my wife or my girlfriend. I think she's really pretty, but I can have sex with her for an hour and a half and not have an orgasm.
Oh, I've had guys report this. Yes.
Yeah, and the best fix I've found for it is let's get you a little testosterone cream. Let's have you put that on the head of your penis in the morning.
Oh,
you need to wash it off. You need to wash it off before you go have sex with her.
Are you going to give her an injection?
She's going to start growing a beard after a while.
Right.
And then you're really going to have a problem.
That's interesting. I haven't heard that before. That's cool. Okay, and yes, I've had guys report that, and some of them are. Yeah, I guess the guys who reported that have been a little older, 40s, 30s. Let's talk about really quick, because I get questions about this too. The different ways in which you can do TRT. So I do injections with insulin needles, and we should probably cover the other options because. Yeah. And there's pros and cons. Of there's a implant and there's cream and there's something else, right? What are the options?
So you've got injectable, right? Injectable testosterone. You've got testosterone topical, and there's a few different options there. And then you've got what you mentioned, the pellets, which get placed microsurgically, very, very minor surgery, into the hip. And then they secrete testosterone over a period of time. I am trained in the pellets. I don't really offer them because I don't like to lose control of dosing.
Yeah.
When you do a pellet, you're just committed to that dose. And it may be enough, it may be not enough, it may be too much, you may be getting a bunch of acne, and you can't change it. So,
could you remove the pellet and put a new one in? That's just a hassle, right?
Well, yeah, but now you got 2 minor surgeries.
Yeah, okay.
I don't see that. I don't see the benefit. Just never. Yeah, so I don't really mess with pellets. So injectable, we've got a few different options. If you go to your standard medical doctor, they're probably going to offer you 1 injection every 2 weeks, 200 milligrams. That's going to make a large peak and a really, really, really long trough.
Yeah, that's terrible.
In the serum level, right? So day 1, you're at 1,1500. And then by day 7, you're back down at 400, and you've got 7 days to your next injection.
Yeah, screw that.
So that's no good. So next step is 1 injection a week. Right? Let's say 200 milligrams. You give it on Friday, and by Friday, for probably 30-40% of men, that works out okay. And that's an intramuscular injection. Mm-hmm. And then another option would be, let's say that didn't work out. Let's say by Tuesday, Wednesday, you can feel it's all worn off. So now we go to twice-a-week injections. Now I've got guys who don't necessarily want to do an intramuscular injection. Maybe they're kind of scared of needles. Mm-hmm. And that's kind of how we would end up on a daily injection cycle. But you can, in fact, use an insulin syringe with a very short needle and end up doing a subcutaneous injection.
Oh, you can?
You can. Now, let me finish. It's going into the fat, which it's fat soluble. It's going to stay there a while. It's a slower burn.
Yeah.
But once you're about 2 weeks into it, it can work pretty well.
Huh. I didn't know that. But that'd be a daily injection. So 7 days a week.
An everyday injection. And it's a pain to draw because it's a thick, viscous oil.
Oh, I know. It's really thick. It's an oil, right? It's like sunflower oil?
Sesame oil. Sesame oil.
Thank you.
Or seed oil. And to get it into an insulin syringe, to get 0.14, which would be a daily injection, it might take you about 35, 40 seconds.
Yeah, you got to be patient. That's what I do.
You got to be patient. So those would be the injection options. Topical, you've got your standard androgel out there. I've seen a lot of cases where, they started off on androgel. Maybe they started with a testosterone of 400, and 6 weeks in, their testosterone might have been 5 and it might have been 3.
I see. Okay.
Because, again, coming back to that, that thermostat furnace analogy, if you're putting it in and you're only putting enough in to meet what the thermostat is set at, you're going to actually lower the total sum.
Right.
Did I say that clearly?
Yeah. Like that's what we talk about when we talk about ACG. Right.
Yeah. I always use the analogy of if I brought in a space heater that's rated for 900 square feet and I put it in a 2,000 square foot room right underneath the thermostat.
Yeah.
What's our net outcome?
Right.
We got a colder room, right?
You're wasting a lot of energy too. Yeah. All that stuff.
Yeah. Because we turned off the thermostat. We turned off the furnace, which was apparently insufficient to begin with. And now we've got too small of a heater trying to do the job. So,
right.
And androgel, I haven't seen it work real well. And when you're putting it, so this is the point I want to come to on topicals. When you're putting it, let's say, on the inner forearms or on the inner thigh, the main job of your skin, Caleb, what would you say that it is?
To protect you from harm?
That's true. That's true. What other functions does it have? It keeps water in the body, right?
Right. And also to secrete waste.
Secrete waste. That's right. It is the largest organ in the body. It's also there to prevent you from things getting inside the body.
Well, that's what I meant. Yeah, protect you. Yes.
Protect you from harm. You can stick your water in your hand in a creek, and you're not just absorbing all this water, which would throw off all your chemistry. Your skin is a barrier, right? And especially on the outside, it has a thick layer of epidermis, which is dead skin cells, that are there, and they build up to create deeper layers of protection. If you use your hands every day, moving a wrench or playing the guitar or whatever you might do, eventually you develop calluses.
Right.
The skin adapts to this increased. So if you're trying to absorb a vital nutrient like testosterone through your skin, you're fighting
a percentage of absorption, right? You're only going to get 30% absorption or whatever.
Right. And if we line up 10 guys and I give them all 100 milligrams on the same place on their thigh or whatever, one guy got 10 milligrams, another guy got 40, another guy got 60, one guy got 80. They all got a different dose, and I don't know what the dose is.
Geez, so we're back to genetics again?
We're back to genetics and just, one guy exfoliates every day. He scrubs his whole body with a loofah. You know what I mean? So he gets better absorption than the other guy. One guy, he absorbed well for a while, but then his body said, God, there's all this testosterone concentrated in this one spot. We don't need so many receptors. So after 3 weeks, his body down-regulated receptors, and he was getting 80% before, but now he's only getting 40%.
Got it. Okay.
So there's a solution, though.
Are there testosterone pills or like troches?
No, it's hepatotoxic.
Meaning?
Testosterone is very, very toxic to the liver.
Oh.
Anything you put in your mouth that goes into your gut is picked up by the blood, and that blood doesn't go systemic. It goes directly to the liver for screening.
Right. Okay.
So we have what we call first pass liver metabolism. Everything that goes into the gut goes directly to the liver. The liver sort of is this gate and says, yep, you can go through. No, you're methylated and marked for excretion. So if you take 100 milligrams of testosterone orally, first of all, you're going to lose 40 milligrams. Second of all, it's toxic to the liver.
Great.
So we don't do that. We don't. I don't even. There are clinics that offer sublingual, but
I've heard that too.
How are you not swallowing some of that spit? You are.
Yeah, you are definitely.
All the saliva in your mouth, you're definitely swallowing some of it.
Yep, you are. Yeah, no matter how good you are at it. Okay.
Right.
So and those are the four of all the options. Those are the four, right? Injectables, the pellet, the topical creams, and then maybe the troche stuff. That's it, right? Those are the only options available.
Those are the only options.
Okay, that's what I thought.
On the topical, I want to say one last thing, which is you can put it over a transitional mucosa and get really good absorption. Now, where is the transitional mucosa? Do you want me to be
Is that butthole?
It's the butthole. That's
butthole.
Right.
Yeah.
Yeah. Right over the butthole. At bedtime, it's not hard. It's easy. So if somebody's real scared of needles and they just don't want to do that, I just have them do the topical right on their butthole every night, and they go to bed and they get up in the morning and shower it off.
Mm-hmm. Yeah.
It does inside. You don't have to put your finger in there or anything like that. You just swipe it over your bottom and off to bed you go.
Mm-hmm.
Yeah. And that works pretty well.
Let's talk about estrogen before we wrap this up, because I don't think it's appropriate to talk about testosterone without addressing estrogen. And I mean estrogen in men now. I am on, let's say I'm taking anastrozole, which is an estrogen blocker. I take half of their pills are very tiny. I take half of a pill, for 24 hours after I inject my testosterone. And the reason I did that is, I don't know if you remember this, I've told the story before. I went on the TRT. I felt great, but suddenly I started getting pudgy, and I started getting like not emotional, but like I feel fat, like a woman. And I'm like, what the hell? And I called you up and I said, what the hell's wrong with me? He said, yeah, your estrogen spiked. And we did some blood work, and you were right. My estradiol went up to like 40 something.
Yeah.
So we got brought back down, and now so why don't you explain what happens with some guys and estrogen? I think isn't it most guys the estrogen will spike, or is that not necessarily true?
So the more body fat you have, the more of an enzyme called aromatase you have. You've always had some aromatase. So estrogen in a male body is always a product of testosterone.
Interesting. I didn't know that.
All the estrogen you've ever had, you produced from a testosterone molecule with an aromatase enzyme.
Oh man, I didn't know that. Interesting. Okay. Yeah. So it makes sense that it would spike if you spike your testosterone a little bit.
Right, yeah. Right. So, and that aromatase happens to live in fat tissue. So as you hit 38 and 40 and you start getting a little belly, right, you have now more fat, you have now more aromatase. Here's the clincher on this, Caleb. Guess what turns off testosterone production? It's not testosterone. And the thermostat doesn't measure testosterone. The thermostat measures estrogen levels. So the more estrogen you get, the less testosterone you get. Okay.
I didn't know that. I'm following. Interesting.
So as you age, here comes this belly fat, right? Right. Now your 900 units of testosterone is hitting more of this enzyme more often. So you're producing more estrogen. Your body begins to shut down testosterone production. And as testosterone drops, fat goes up.
Yeah, so it's a vicious cycle.
And as fat goes up, aromatase goes up. And as aromatase goes up, estrogen goes up. And as estrogen goes up, fat goes up. So
this is why a lot of men say, a lot of guys, fitness guys and things like that, when you see a guy over 40 or even not quite 40s where they have that big pot belly, that's probably a high estrogen guy, or could be. Yeah. Okay.
So let's say a few good things about estrogen, because it is an important molecule. Nature wouldn't have created it if it wasn't. You know, I get some guys who are like, I want to drop my estrogen to nothing. Estrogen is why you have bone density.
Right.
So if you don't want broken bones when you're 65, we need to keep your estrogen in check. Estrogen plays a role in erectile function and libido.
You mentioned once years ago when I said, what would happen if we just drop I think I was one of those idiots. What if we just drop my estrogen to 0? You said, well, you won't be able to get hard during sex. I would say, oh, okay. I don't want that then.
Yeah, no. With a highly suppressed estrogen, you're going to have malfunction, including erectile dysfunction and low libido and all sorts of other things.
All kinds of stuff, yeah.
Nature is my guiding principle. Homeostasis of physiology. You know, where physiology is when we're at our prime. That's what I'm always aiming for.
Right.
Right. You can't get a better set point. You know, a better example, and you can't improve on it because there's 4.2 million years of adaptation there.
And so you want correct me if I'm wrong, the number I have in my head when I do blood tests, and again, I'm using American numbers, guys, so translate if you need to, an estradiol score of between 20 and 30.
That's about right? Yep, that'll maintain bone density. It'll maintain erectile function and libido.
Right. So not below 20 and not above 30. Yep. Not below or above, because those are both
unchecked, Caleb, not only does it create subjective misery, right? You don't feel well. You're overthinking what everyone's saying to you and all that.
Oh, shit. It was terrible. It was like 2 weeks. It was awful.
It's awful.
Yep.
But it also creates increased cardiovascular risk. It's why as guys hit 55 and 60 and their testosterone's gone and their estrogen is high, their cardiovascular risk is much, much higher.
Mm-hmm.
Right? Their stroke, heart attack, right?
Because they're high. Why is that? When their estrogen is high, why does that cause cardiovascular problems?
Mostly because it tends to generate inflammation.
Got it. Okay. Understand. Yep. That's very bad. That's bad across America.
Inflammation is not good.
Yeah, that's like the problem with Americans and now Europeans too, is too much inflammation from our diets and things like that, right?
Okay.
Yeah. Okay. Cool. This has been great.
Yeah, I've really enjoyed it. I always love talking to you, Caleb.
And if guys want to get in contact with you, your website is antiagingnorthwest.com. And that is not NW, that's the full word Northwest. And to be clear, you can only really assist guys in the United States, correct? Is that correct?
Yeah, you've got to be, if you live outside of Washington or Oregon, which are the two states I'm licensed in, then if you want to do treatment, you can come to one of Caleb's events and I can meet you there, or you can fly into Spokane and I can meet you at my office. I've also had guys, take a small vacation to the Oregon coast and call me from a hotel.
Oh, that's cool.
As long as you're in one of the states I'm licensed in, when we do our initial consult, you can be my patient. And from that point forward, the pharmacy can then ship you your meds wherever you are. And then, once every 4 or 5 visits, like once a year, once every year and a half, I need you to fly back in and have another visit in state.
I forgot to mention that you are now working with at least 4 or 5 guys from our Alpha 2.0 Focus program, right? At least 4 or 5 of those guys, right?
Absolutely. They're doing great.
Yeah, they are super pumped. It's one of the biggest things they talk about is getting their blood tests. Like, oh, this is great. It's awesome.
It is, testosterone replacement therapy, when you're doing something like the Alpha 2.0 program, is a catalyst. I mean, you're giving them so much powerful information, right? And then you put a little testosterone back in their blood, and they're just on fire.
Well, I have told guys, and I probably shouldn't say this. This is probably not appropriate for me to say it, but I tell guys in my audience, if you're over 40 and you're not a genetic freak, like your guy in his 70s who was at 600 plus, or these guys in their 40s and their natural testosterone not doing anything is like 700 to 800 plus. But those are odd exceptions. If you're not that guy, TRT is almost a requirement if you want to do the things we talk about at Alpha 2.0, because you're not going to be motivated enough or excited enough to get these things done post age 40 now. No. If you don't address this, however it needs to be addressed, right?
You don't have the intelligence.
Yeah, right.
I didn't. You know what I mean? Yeah,
exactly. Right. And
it's kind of a cool joke. As you get a little wisdom, your motivation dies.
Right. Yeah, that's right. And real quick before we go, you've mentioned this before. We're now at the point now where, because of our environment and things like that, you've got guys in there like as young as mid to late 20s who sometimes have low TRT or low testosterone.
Endocrine disruptors
yeah.
are making endocrine messes in younger and younger men. I have 26-year-olds who have a testosterone in the 100s.
Insane. Now,
exposure to pesticides, exposure to plastics, exposure to petrochemicals,
all that shit.
I know everybody likes to say good things about cannabis, but overuse of cannabis.
Yep.
Overuse of opioids. I'm not anti-cannabis. Cannabis is just fine. It's good for a lot of things. But overuse of cannabis will lower your testosterone.
So that means, you listeners, if you are even in your 20s and you feel depressed, tired all the time, not motivated, not excited, I get your emails. Some of you younger guys are 20s, you millennials, or even early 30s, and you're like, I just want to do anything. Go get a blood test and check your testosterone. By the way, you should check while you're doing it, and correct me if I'm wrong, Phillip, is you should check testosterone, and if you can, estradiol, T3, and vitamin D. Right?
Yep, and on that estradiol, it is very important that it be an ultra-sensitive LC-MS, which is a gas chromatography, because the other estrogen test is pointless.
Yes, correct. I have that written down.
And Caleb, one last thing on that. The 20-year-old guys who maybe have encountered endocrine disruptors, oftentimes we can get them on a program for 3 or 6 months. If they're willing to do some work to clean up some things, often we can titrate them down off testosterone, increase their peptides that will stimulate the production of testosterone, and then titrate them down off of that.
Oh.
And go on another 10 years without having to do it.
Oh, so it's like a temporary TRT just to get you back to where you need to be.
Because they haven't reached age-related decline.
Right.
Right.
Oh, that's interesting. I didn't know that. That's cool.
Yeah. For the younger fellas, that would be what we call secondary, testosterone decline. There's some causal factor in place, and if we can correct that, you know what I mean, get them up out of a hole with some TRT.
Right.
So
they're on TRT for like 4, 5, 6, 7 months, and that's it, and then they're off.
Yeah. As long as they're willing to do some lifestyle work. You know what I mean?
Yeah, that's the big thing. They got to change their lifestyle while they're doing that. Correct. Right. This has been great. I love it. So you guys, if you're interested in his stuff, antiagingnorthwest.com, and if you like this material, if you want him back, let me know in the comments or the email, and I will certainly have him back. I'll probably have you back either way because I like him.
I always love to talk with you.
Right. Cool. Thank you very much. This has been great.
All right, Caleb. Thank you so much. You have a great day.
All right. Thanks.
Bye-bye.
Bye.